Welcome to Muted in Medicine, the podcast where we break the silence on the untold stories and pressing issues within the healthcare professional. Join us as we dive deep into topics that often linger in the shadows of medical corridors and are not discussed in conferences, meetings, social gatherings, and in the hallways. They are often hiding. From navigating errors and facing litigation to the often overlooked realm of mental health among healthcare professionals. Through candid conversations and storytelling, we aim to amplify the voices and shed light on challenges that resonate across the medical landscape. So grab your stethoscope and a cup of coffee and tune in as we uncover the layers of complexity in the world of healthcare that are so muted, yet so profoundly impactful.
Hello, everyone, and welcome back to Muted in Medicine, the podcast where we break the silence on untold stories in healthcare. My name is Saba Fatima, and I'm your host for this podcast. I'm a pediatrician with a passion for helping healthcare professionals facing secondary trauma at work in healthcare. Today, we're talking about artificial intelligence in healthcare. Artificial intelligence is no longer just a futuristic buzzword. It's here, shaping the way we diagnose, treat, and even relate to our patients. But with every promise comes a set of questions. Can AI truly enhance patient care, or does it risk dehumanizing it? Will it relieve clinicians of burdens or replace them entirely? Today on Muted in Medicine, I sit down with Dr. Graham Walker to explore what AI means for the future of healthcare, its possibilities, its pitfalls, and what it means for those of us who still believe that medicine is, at its core, a profoundly human practice. Dr. Graham Walker is an emergency physician and health tech leader based in San Francisco. He serves as co-director of advanced development at the Permanente Medical Group, where he drives innovation and digital transformation for Kaiser Permanente's 4 million Northern California members. As a clinical informaticist, he leads emergency and urgent care strategy for Kaiser's electronic health record. Dr. Graham Walker is also a software developer and entrepreneur. He founded MD Calc, the leading evidence-based medical calculator platform, and OffCall, a new digital hub supporting the physician workforce. Dr. Graham Walker, welcome to the show.
Saba, thank you so much for having me. It's great to be here.
Yeah, and we ask everybody when we start, what's bringing you joy in medicine today?
Oh, what's bringing me joy? I would say the opportunity to have an impact, both directly. I'm going into work in a few hours, individually, one-on-one. Hopefully, I impact and help my patients today, and more globally. I love that I get to write and talk and think about AI and technology in the future, and that people care what I say.
Yeah, no, they definitely do. I recently watched one of your podcast episodes and it was really good. So thank you for doing that. But so you're working still clinically and you get time to do all of this? You're still doing clinical work?
Going in 2 to 11 tonight. Yeah.
Oh gosh, okay, good for you. So when you hear the term AI in healthcare, what's coming to your mind? Is it promise? Are you concerned just at first off?
When I hear AI in healthcare, the first thing I hear is generative AI in healthcare, because that's typically what people mean. They see ChatGPT or they're using Gemini or Claude or something like that. And so I think unless you're really specific, when people say AI, they actually mean generative AI, and they usually mean a large language model. And then I think the other thing that comes to mind is both too much fear on one end and too much maybe optimism on the other. I think the two extremes we hear about artificial intelligence in healthcare are extreme on both ends.
Yeah. And I guess going on both ends, so where do you think AI is most helpful to clinicians right now or helping them?
Yeah, we're seeing lots of interest in the AI scribe space. I think the AI scribe space is there because it specifically is attacking something that is mandatory, painful, and kind of self-contained enough that it can be addressed and changed. There are plenty of other problems, and I bet you probably every AI Scribe company founder would probably tell you, yeah, AI Scribe is not the largest problem in healthcare, but I think they would all say it is something that we can address today versus, other things have lots of other dependencies that I think make it harder to like immediately tackle.
Yeah. And, there's increasing concern about, AI. How is it going to replace clinicians? So what do you think, AI will be able to replace it, or what do you think it can never replace, I guess?
I think it can happily replace a lot of the busy work. And, the term, I was talking with somebody earlier this week, like the legwork piece, I think, legwork is a really good term because it doesn't just mean kind of administrative work. It doesn't just mean stuff that we think is like annoying. But legwork to me always means, stuff that has to get done, regardless of if that's administrative or clinical. So I like that term legwork a lot. And then the thing that I think it will never replace is what I typically have been calling it clinical judgment. That I am using my medical training and my medical experience to decide to do something or not do something. And I think that is very different from, it's the difference between taking a textbook, answering a textbook question about medicine and seeing a patient. Those things could not be more different to anybody that practices medicine.
It reminds me of what my sister told me a few weeks ago. I love her to death, but she's like, ChatGPT is a better doctor than you because it actually listens and answers and is responding appropriately.
It's able to have infinite time. I think the thing we can learn from that and steal from that is that A, patients have lots of questions. B, patients want to understand things more. They want to be asking these questions. So how can we leverage our patients as a resource to help the health system and help themselves get better care as well?
Yeah. And I just asking you, do you worry about your job security with AI? Like just talking about yourself?
I don't think so. I don't at all. In emergency medicine, look, most of what I do is A, chronic disease management, and B, management of, in some ways I'm like a healthcare navigator to some degree. I see a lot of people with chronic illnesses and people with decompensation of their chronic disease, and I see a lot of people that are kind of fall through the cracks of the healthcare system as well, whether that's a chronic issue or a new issue, and they just don't know where to go. I don't see anybody in the healthcare system trying to address those, honestly. Who's jumping at the bit, jumping at the opportunity to manage like elderly patients with diabetes and congestive heart failure? Like, I don't see anybody that's like, oh my God, I can't wait to do that. And so, it's an area that I think proudly emergency physicians are always willing to step up and do what we need to do to help our patients. But I'm not worried about my job security at all.
Okay, good to know. But how about other fields? You think like in the future, like radiology or some of those fields which rely on a lot of behind the scenes work? It's great work. Do you think those would be affected?
I think in the specialties that tend to have more imaging and other types of data, I think those roles may change. I still absolutely see plenty of work for radiologists to do, pathologists to do, dermatologists to do. I think like anything else, we will uncover and like pivot away from the 50% of low quality work that maybe a radiologist or a pathologist is doing and find other work that is way more valuable to do, in the same way that, we're not running our own CBCs anymore. We have decided that there's an acceptable automation to complete blood counts that is as accurate as a human. And there is a flag that can flag this as abnormal that needs a human review, and that's great. But I wouldn't argue that any intern or resident in the hospital doesn't have things to do because we automated away the CBC. So I think we'll find those same areas where, like, hey, we are perfectly okay with this being handled by some sort of system, whether it's truly just automation or it actually does include an artificial intelligence or an augmented intelligence piece. But I think we'll look. There's plenty of work to do in healthcare.
Yeah. Yeah. And what are some of the pitfalls that you see for somebody who's seeking healthcare through like ChatGPT or some of those AI platforms, especially for the general public as well, or if we use it for our benefit as well? Because I read something recently, and ChatGPT was giving like doing therapy for someone, and that
Yeah.
is and that was a bad outcome related to that. It was coming on
Sure.
social media. So what are some of the pitfalls that you see?
Yeah, I mean, we don't know what we don't know. I mean, this is true of all humans, whether you're a patient or a doctor who's a patient. We don't know our own biases, and then specifically for generative AI and large language models, they only know what you tell it. And so, the example I always use is pregnancy. You might have in your head that this patient is pregnant, and therefore you're asking the tool about the management of, hey, how should I treat this patient with pyelonephritis? If you don't tell it, maybe the patient has 30 medical problems, and so you go through and you say, oh, this patient has a history of transposition of the great vessels and, cholecystitis and, all these 50 things, and they're on 12 medicines, and you forget to tell it that it's pregnant, it's going to probably give you some really good recommendations for someone who is not pregnant. But we both know that there are certainly potential dangers if it doesn't know that fact. It may also not, it's not going to prompt you and say, hey, do you know if this person's pregnant or not? That's a standard thing that we humans all do in our heads for patients of childbearing age with a uterus, but that's not baked into how a large language model, especially the commercial ones, were built and trained and created.
Yeah, and
they're
you're
built
right.
to just answer your questions really well. They're not built to necessarily nudge you or force you to ask better questions, like maybe like a really good attending might,
Yeah. On the flip side, though, humans prone to more errors, like
Yeah.
we talk about medical errors all the time. And I agree, like having used it myself for a lot of like content and everything, you have to like nudge it a lot of times because
Yeah.
it can't do it for itself. But humans are more prone to errors. So do you think in the future, like it can help us with some of that, like
I hope
deficiency?
so. I hope so. There was a study that OpenAI did with a company in Kenya with real patients, and the AI was kind of listening in the background to how the clinician was managing the patient, and then it could flag things that it said, hey, you might want to double check this, either check this dosage, or hey, it sounds like you think the patient has a viral upper respiratory infection. I just noticed that you ordered some antibiotics, so you might want to double check that. So I think there are ways it can passively be watching and recommending the best care. But we have to design the tools to behave that way. They're not going to behave that way on their own.
Yeah, they're gonna learn from us. Have you used have you used AI in like for diagnosis or treatment, or what's your interaction with AI? How do you use it?
That is the area I use it actually the least, and I think that's consistent with a lot of research and cognitive science information about the usage of these tools. We tend to use these tools more for things that we probably rate ourselves as not very strong on. And so, I think I'm a pretty well-trained emergency physician, and so I tend to not use them for the things that I feel like I'm strongest at. But if you were to ask me to come up with a PR plan, or ask me to come up with a report on the tectonic plates, yeah, I'm probably definitely going to use it for those things because I'm not an expert in those. So I tend to not use them clinically. Also because I think there's certainly risk there. And if I do use them clinically, I'm using them like after the fact to kind of like test and see how well it does. It's more of like an experiment than using it with the patients that I'm going to like see later today in the ER.
Yeah. And what do you use it for, though? Do you use it like in medical education or anything like that? Like,
I think it's great for I think it's great for medical education. It's really great at coming up with fake patient data. So if you wanted to write a really good medical note because you want to use that in a demo or a demonstration or some other project, it's really good at writing notes that look really realistically kind of medical,
Yeah. And then you use the scribe part or no? Do you use the scribe?
I do use the scribe some. I'm a computer nerd, so I'm an extremely fast typist, and I've made a bunch of templates, so I can do, there are a lot of fairly algorithmic chief complaints or problems in the ED that I can write a note probably way faster than an AI scribe can. But it's because it's a very straightforward thing, right? It's a laceration, or it's a patient who's intoxicated, or it's a patient who, has croup or COVID symptoms or whatever. Like, generally speaking, most of those patients have generally straightforward histories and physical exams,
Yeah, so you don't need it. It'll probably take jobs from scribes, though, like real scribes.
Yeah, real human scribes, absolutely. Yeah, I totally believe that.
Yeah. Have you heard like people around you or clinicians that you work with, they're worried about their own worth or identity, with the AI, or you don't think that's a common fear that's going on?
I think it's a common fear for many people. When people express that concern to me, I tell them that they should be using these tools more and more, and I think they'll actually become more confident that these tools are not going to take their jobs, or there's still a place for them. Typically, the people that seem to be the most worried are often, not always, but often are the least experienced with using these tools because they have a little bit of a boogeyman sense, or they've not seen the tools fail yet or make gross errors or gross mistakes. And so I think they maybe have a sense that these tools are perfect, right? They're perfect, and they know that they themselves are human, therefore they are imperfect creatures. Yeah.
And also thinking about, hospital systems, because it's going to be a lot cheaper than whatever you're paying a physician or,
Yeah, that's
practice.
certainly that's certainly a worry as well, that even if the tools make the physicians more efficient, that time savings or dollar savings will not be invested in you having a more human conversation with the patient. It will be invested in squeezing in a couple more patients into your day.
Yeah. And all the medical AI programs that are coming up. So do you think there should be some policy or regulation, or what do you think should be standards that should be in place, before they're ready to help us out?
Yeah, it's a good question. I think there are a lot of different kind of regulatory frameworks. Personally, I think that the healthcare systems in the U.S. should be coming together and creating those standards themselves. I think the technology companies are running laps around the healthcare companies and the health systems, and moving much faster. But I think the health systems should work together and lead in this space and come up with like a triathlon, come up with like a really challenging set of things that would tell us, hey, yeah, these things seem like they're working pretty well for all of these, varieties of either clinical tasks or types of patients, right? I mean, you and I have to see any patient with any list of medical problems that walks through the door. Generative AI is really good with straightforward, simple patients, but a lot of the work of medicine is dealing with the complex, nuanced patients that generative AI has never seen before. I mean, I'm sure I will go into work today and see some combination of signs, symptoms, vital signs, age, medication list, and problem list that the world has never seen before,
Yeah. And when we're talking to AI, like, so because you're a computer nerd, I'm asking you, so
Yeah.
it's taking our information sort of that privacy and safety. I almost feel like it's taking my brain from me because I'm feeding it everything.
Yeah.
And now it has the profile, So do you worry about that or no?
Certainly around patient privacy, I worry about it greatly. The consumer tools, ChatGPT, Claude, et cetera, do certainly use all of your chats to make their models better. So they use the way that you write and the way that you kind of talk and communicate to make their models better. And I mean, it's training data. So if you're putting in, Graham Walker, 45-year-old male, date of birth, blah, blah, blah,
Yeah.
that's a problem. I don't personally, Graham Walker, care about how ChatGPT or Claude is using my information because I also limit what I share with it about me. I'm not giving it my medical record. I'm not giving it my bank details, the kind of confidential information about me. But I know some people are, and I think those people should absolutely be concerned about how much they're sharing. I mean, some of the stories I've read is that some people are spending, hours and hours a day talking with and interacting with these people, and these tools are kind of, I mean, these are extreme cases, but these tools are like kind of running these people's lives to some degree.
Yeah. And also, like you said, so it is using the chats to improve its models, right? Like that's what it felt like. It's kind of learning from you because when you ask them the question the next time, it gives a more nuanced answer than when you ask the question.
I mean, I like that as a feature, right? I like that it knows that I created MD Calc and I created off call and I work at Kaiser Permanente in San Francisco. I like that because it gives me better answers that are relevant to me, that are would be less relevant to you. But I also am aware of I also intentionally create a firewall and I say, well, I'm not telling it about where I bank. I'm not telling it where I, where I live. But I think other people do not have that kind of more nuanced understanding that I do.
Yeah. From your perspective, would AI have bias or just talking about the healthcare disparities and in general, if you're talking about healthcare, does it have bias? I don't know.
Absolutely. It absolutely has bias. The bias is human.
Mm-hmm.
If humans were not biased, AI probably wouldn't be biased, but we know that we are in the way that we treat different individuals or different groups, and AI is trained on humans. It's trained on the way that we talk and write and see the world and the correlations and the stuff that we believe in, and so it's absolutely biased. I think it is the wrong approach would be to say, hey, is this AI biased? And I think the right approach is, oh, this AI is biased. Is this bias harmful, or where is the bias? Like, look, hey, it's there. You might have to look for it a little bit, but it's there. Because we know that humans are kind of imperfect and biased as well.
Yeah, interesting. Yeah, I never thought about it because it's trained off humans. Then it has the same biases as humans, so it's not
Totally.
better. Yeah.
These things are ultimately extremely, and extremely is even an understatement. These tools are the ultimate, the most powerful pattern recognition machines in the world. And so you can give these tools a task or a pattern, and it will figure out that pattern. It might not do it in the way that intuitively is human or makes sense, but it will find out a pattern. I'll give you an example, if that's okay. I saw there was a study many years ago. I mean, this is probably 10 years ago now, that the machine was really good, an AI model was really good at looking at chest x-rays and predicting pneumonia, until you realize that the way it predicted pneumonia was it was reading the serial number of the x-ray machine that lived outside of the ICU. And so we know that ICU patients are more likely to have pneumonia. They're more likely to have, ventilator-associated pneumonia. And so, well, yeah, it's an easy shortcut to say, if this patient had their X-ray taken by the ICU portable X-ray machine, they might have they're more likely to have pneumonia, and the one taken on the floor is less likely to have pneumonia. So these tools will find patterns that are surprising to us. Make sense often make sense once you understand them, but obviously that's not what you want in a model to predict pneumonia necessarily.
So it works on patterns, but not cognition, cognition.
It's just like any other, it's just like any other predictive score in medicine. If you're you take, humans did this for many years before computers. You took 300 patients with pancreatitis, and then you took all their data points and you tried to think of, God, what lab tests and what vital signs and what age limit, what things matter in outcomes of pancreatitis. And then you follow those people and you collect all the data, and then you run a model, you do a logistic regression analysis and you figure out which ones mattered. And then you confirm it in a new sample and you say, great, I can now predict who's going to have a bad pancreatitis outcome or whatever. That's the same thing that AI is doing. It's just doing it way better. And for generative AI, it's just predicting the next most likely word that you're going to use based on the context you've given it, which is the prompt or the prior conversation or the memory it has about what your name is or something like that.
Yeah. And did you see it coming? Because you made MD-Calc, so you're probably into all these things before. Did you see it coming, like long before it came? What was your first interaction with it?
No, I did not see it coming at all.
Okay.
I give credit always to my colleague Scott Campbell, who spent years trying to get me to pay attention, and I was busy with other informatics challenges, and he kept telling me about AI, and I was like, yeah, whatever, Scott. And then ChatGPT, launched in November of 2022, I think, and something flipped in my brain, and I immediately was like, oh my God, if I would have not been paying attention.
Yeah, that's awesome. And just going back to the thing that you were saying before, I think AI makes mistakes because I've seen it so many times myself. I've caught so many mistakes. So it makes sense. It's kind of working off patterns. Like, I don't know.
And it makes very subtle, not always, but it often makes very subtle mistakes, right? Like, even now, like I think, I feel like hallucinations have improved a lot in the past several years. But even now, I think sometimes myself and others get a false sense of security that like, oh, hallucinations have been not solved, but improved so much that it's not going to make such an obvious hallucination. And that's certainly not true. I still find very obvious hallucinations, that look very plausible. The most common example is, if it gives you a reference and, like a research article reference, it'll put it in the exact right format. It'll give a page number. It'll give a year. It'll give a DOI. It'll give a PubMed ID. And then you actually search for that article or search for that PubMed ID. It's total made up.
Yeah, it happened to me so many times.
You really have to actively choose to pay attention.
Yeah, that like I said, happened to me so many times, and I was like, "Why are you doing that?
Yeah,
Like, you're so smart." Yeah, but I agree. I think it's for anyone who's listening. Like, yeah, the articles, always check your references because they're almost many times wrong.
Yep.
What is the ethical use of AI? In medical education and all the work that we're doing. What can and what can we not do? Have you thought about that?
I mean, the medical education piece is the piece that I think worries me the most because I don't know. I feel like the way I was trained, and this is maybe just an older way of training. I'm sure we'll come up with new models, but the way I was trained was, you learn from your own pattern recognition, and you learn from your seniors, and you get educated from both a mixture of like book reading and experience, and people supervising you, and helping make sure you don't make mistakes. And I don't know how that works. And all of those things combined help you build your gestalt and your spidey sense. We use that a ton in the ER. You use it in pediatrics when you're like, hey, there's something looks wrong with this kid. I can't exactly tell what it is, but hey, there's something wrong here. And I don't know how a human develops that spidey sense if the AI is kind of giving them the answer before they've even seen the patient.
Yeah.
Like it's almost like if the AI is, imagine like a model that tells the resident or the med student, oh, this patient has sepsis, and now they walk into the room and they're already like, oh, I guess this is sepsis. It must know better than me. And it's like, it's not. It's a GI bleed, but the model flagged it as sepsis. You do that over and over and over again, where AI is kind of giving you what it thinks the answer is. Add on the fact that AI might be right 80% of the time. How do you end up forming that ability to, again, going back to judgment, to be able to judge and make a determination? Hey, are the things the patient is the things the patient's saying, is the data I'm collecting at the level that I should do X? I should get a chest X-ray. I should order labs. I should give antibiotics, do a lumbar puncture, admit to the hospital. Any of those decisions, which are very much like binary. A lot of that, I think, is based on that like medical brain that I developed over all of med school and residency and my years as an attending too.
Yeah. And so do you think that it should be incorporated as a tool in medical education? Because I've often asked myself this question, does it make me less smart? Like, because I'm using it, do you think it makes us less smart because we're using our brain less because we're relying on that?
I think I think it makes us less smart if we're using it for the medical thinking parts of our brain. I certainly worry about that. I think there's other areas that it's fine that we are less smart in a particular domain. Like if you asked me to go read a CBC right now, I would probably have to read a couple articles about it, read a textbook, and then I probably would look at it under the microscope and do one. I'd probably still be really bad at that. And I think it's fine that I'm bad at reading CBCs personally right now in my career. But there's other things that have replaced that CBC task in my list of stuff that Graham Walker, the attending physician, is responsible for. So,
yeah. In 5 years, what do you think AI in medicine looks like? Have you thought about it?
I think there's a couple different outcomes. I think there's an outcome where it is, there's a harmonious outcome where it's all working well and it's zen and kumbaya, and physicians feel more engaged and more self-actualized because we're doing the stuff that really a human needs to do. There's that one ideal. There's like a really, there's a nuclear winter scenario where AI makes a bunch of mistakes, and doctors listen to those AI mistakes, and society, doctors groups, patients groups say, no, I do not want AI used with me. There was some stories in the media of deaths and major problems because doctors used AI or patients used AI. And, there's like a moratorium for 5 or 10 years on AI, which I think would be really bad generally. And it's the reason that I speak so frequently about how we have to do it right. Otherwise, the alternative is people are just going to say, you can't use AI with me. And there's probably the more likely scenario where some things are better in the next 5 years. There's a lot of transition and a lot of people trying to figure out how to use this tool really well and really safely. And I think we will figure out a lot of new guardrails and new approaches it's kind of like the, when the iPhone came out, it was like, oh, wow, a smartphone, it could do a lot of things. It could, but there were a lot of things it couldn't do. And then they added an app store, and then that turned the smartphone into a thing that could do a lot more. And I think if you looked at the original iPhone versus whatever, iOS 5 or whatever, when there were new features, people would think those are actually have two highly different capabilities, and that the one that has the App Store is way better. So I kind of think of that's how it will be with AI, is like we have this version today, and it's kind of like the AI is in kindergarten. And as we add more tools and rules and fixes and improvements and new ways to use it, it'll actually be way better. And people will be like, I can't believe we were using that really basic version of ChatGPT in 2025.
Yeah. And I mean, there's a liability piece of it too, right? Like, who's going to be at blame? How are they going to blame the doctors?
Yeah, I mean, certainly that is one of the concerns, and how it feels is that the physician will ultimately be responsible no matter what, which, I've said before, if that's the case, that'll just set the speed of AI adoption. If physicians are told, hey, if you use AI or not, you're still responsible for literally everything, and if anything goes wrong, it's your fault, then doctors will be way more hesitant and slower to adopt AI tools that could truly help them and truly could help their patients. If there's a model that's like, oh yeah, hey, we're going to build tools that have more transparency, or we're going to understand of a new shared risk model to how AI works, because we think generally the benefit dramatically outweighs the risk, but that we understand that having a physician be fully responsible for this doesn't seem right, then doctors will adopt it more rapidly.
Yeah. Is there some tools that you've already incorporated, like at your institution or where you're working, or are planning to incorporate, or no, nothing yet?
Besides AI scribes, no. I think there are a lot of tools we could, but then we get to the challenges of change management. If we adopted 10 tools today, maybe in a year or two we might still be using 2 of them, and then was that a good use of our physicians' time to train them, educate them, get them oriented and onboarded to use this new tool? If it's integrated into our EHR, was that a good use of our time? If we're all trying a new thing from a new startup or something, but the startup ends up not making it and is, kind of goes bankrupt and goes away in a year or two.
Yeah. What are you excited about, in AI's future in medicine? Is something that you're really excited about?
I'm excited just to see so many physicians interested in talking about it.
Mm-hmm.
Physicians, I think, typically are, we're culturally, I think, generally a conservative and fairly quiet and not outspoken group. But I'm very excited by how many doctors really see the potential, but also are talking about the risks and are concerned that we do this for us and for our patients and do it the way that we think it should be done, not the way that an administrator or a tech company or anybody thinks it should be done. It needs to work for us if we are going to trust it and use it.
Yeah. And what most concerns you? I read something about when the new version of ChatGPT came out, even the person who created it was worried about how good it was, something like that.
Yeah.
It's kind of scary. So what is most concerns you about it?
I think there's a lot of concerns. One is just the black box nature of it, that, if I order a CAT scan, I can look at those pixels myself, and even though I'm not a radiologist, I can see if I think there's a pneumothorax or there's a intracranial hemorrhage or an appendicitis or something like that. When the AI model says, don't do a CAT scan, I don't think this is appendicitis, and that's just it took in 300 variables and it just spit out, yeah, you're good, you can discharge the patient, they don't have appendicitis. Well, based on what? And often these tools can't explain themselves, or explain themselves in a way that would make sense to a human, because they're not, with 300 variables, no, you couldn't concoct a story that would make sense for any human that included 300 variables. Well, they're 6.5 years old, but not 7, and they're female, and their white count is 10.7, not 10.9. Their sodium is 136, not 132. All these little variables can ultimately add up to true knowledge and accurate prediction, but not in a way that you or I are going to be able to understand it.
Yeah. Yeah. I want to go back on something you said. We're going towards our end, but the dehumanizing. So AI does show compassion. Like we talk about how it can dehumanize patient care because, the actual body language, the way you talk to a patient, like all those matters. But AI does show like compassion, like the way I've had, I don't know if it can show compassion, but like you said, it's trained from humans. So, it has some of those mannerisms. And I want to go back to what you said about, it has more time to do all this while when we are behind all those paperwork and you're moving so fast in the ER, you may not have time even though your skills are better. So I'm just curious, like we're saying it's dehumanizing, but I've heard like several people tell me like it gives me more time. It's more compassionate compared to an actual human. What do you say about that?
There's studies that if you use an AI to respond to emails and secure clinical messages, patients like it better. But then if you tell the patient, "Oh, this was AI generated," they like it worse. I think there's two things. One, I think there will, as AI gets ever closer to being in every part of our lives, I think there will be not a backlash, but there will be a sense that people get kind of annoyed with the way AI talks and get annoyed with the floral language because they know that there's not a person behind this response. There's a bot. At the same time, there is stuff that the patient just needs an answer to a question, and it's actually not. I don't think compassion is an important part of the equation, right? So, like if you're trying to get your colonoscopy, and you just need to know, like, hey, do I start the prep at did the doctor say 2 p.m. or 4 p.m.? Or, hey, I Googled and I can't remember, do I go to the ambulatory surgery center or the clinic because they're across the street? Well, do you want a doctor answering that question who's busy trying to see other patients? Does the patient really care about the compassionate response to when to start your bowel prep? Or do they really just want an answer as fast as possible, but they want it to be the right answer? Like, I think that's the area that that AI should take over for. Like, help answer questions that compassion isn't part of that equation. I'm not sure that it should be. That's not a useful thing when you're just like information finding. But, after the patient wakes up and you say that they found a mass or something like that, compassion is absolutely part of that conversation. But, it's like the nature of the question, I think, or the nature of the expected answer, I think is probably important. And I don't think we have clearly framed it that way or understood it that way. Like, when does compassion matter? Because sometimes, no one wants no one wants someone to be a jerk, but if you're just like, if it's 1:55 and you're like, do I start the bowel prep at 2 or 4? You don't really care that much about a compassionate response to that answer. You just want the correct answer as fast as possible, I guess.
Yeah, and
that's what I want personally, at least, I guess I should say.
It's a good point. For obvious reason, there's also boundary, right? In like a doctor-patient relationship. And I think there's boundary, there's hierarchy still to this day. So you feel like, if I ask this question to my doctor, they'll get annoyed, or it's not a decent hour to ask that question. So that's a good point that AI could be used,
Yeah.
for those things. But also I'm going to say, I've heard people say, AI is my therapist, like that sort of thing, which I think is kind of dangerous in that sense. So.
Yeah, there are tremendous risks there. It ultimately gets back to what are the values that the patient, the medical system, society wants to hold as most important and how they rank, right? Is it, there's tremendous risk from using AI as your therapist. I wouldn't recommend that for anyone. There's also benefit to some people for using it as not as a therapist, but using it as um, having you see a different perspective on how you're thinking about the world too. So, I think it's a tremendous challenge that we are just starting to address and brace for.
Yeah. Double-edged sword. Yeah. We are going towards our end. Is there anything that you haven't said yet, or just a message for clinicians who are worried about AI and their future that you would like to say as we conclude?
Yeah, I guess I would just say, if you're worried, reach out to your colleagues. There's probably other people that are worried. Try out these tools. Kick the tires. Don't use PHI obviously, but give it some scenarios. And once you give it enough, or give it a complex enough scenario, you will see these things starting to make mistakes and make errors, and you'll have a better understanding for how AI could be used safely and where it shouldn't be used as well, because you use the tool more. It'd be like if you are a pediatrician, you probably don't have a huge opinion on how to what the right approach is to do a heart transplant. I don't either. But if you were to start shadowing a transplant surgeon and watch a few, you might start to have an opinion about the right way to do it. So I think experience really is helpful. Talk about this and tell the world what you and your specialty want or demand from an AI tool to help you and help your patients, but still be ethical and fair and safe.
Perfect. Any message to patients who are using AI? Would you say something to them who are listening?
I would say that the tools can be helpful, and they probably are more helpful than kind of the Dr. Google of 5 or 10 years ago. And they probably are more accurate, but you don't know what you don't know. And patients have kind of blind spots and can't be objective. And I think doctors try to be more objective, and I think we generally are. But the tool's only going to know what you tell it. And so if you forget to tell it that you had your gallbladder out last year, it's going to probably recommend getting your gallbladder out if you, if you're having upper abdominal pain or something like that.
Yeah, awesome. Thank you so much, Dr. Walker, for doing this with us today. It was really helpful, insightful as well, just to learn how you were seeing it. And maybe I thought you were going to say it's the thing, because you were you like technology. But
I'm a cautious optimist about this technology. I see all the ways it could be really, really, it can and it will be really, really helpful for us. But I also see the risks, and I don't want to oversell one side or undersell the other.
Yeah, and that was good to hear. That balanced kind of debate that we did. Yeah. We do have a tradition on this podcast. We ended with a small poem. So if you will stay with me for that, as we think about AI and the future of medicine, I want to leave you with a reminder of what remains timeless. So it's a poem by William Martin, and it's called "Do Not Ask Your Children to Strive," because no matter how advanced technology becomes, it's the ordinary joys, and the connections we make that give our lives meaning. So do not ask your children to strive for extraordinary lives. Such striving may seem admirable, but it is the way of foolishness. Help them instead to find the wonder and the marvel of an ordinary life. Show them the joy of tasting tomatoes, apples, and pears. Show them how to cry when pets and people die. Show them the infinite pleasure in the touch of a hand, and make the ordinary come alive for them. The extraordinary will take care of itself. Thank you, Dr. Walker, for doing this.
I love
that.
That was wonderful.